Hello and welcome to this edition of FI TV. I'm your host, Brad Swanson. We are coming to you just a few blocks from Florida's capital during the 2022 Florida legislative session. We are here with our good friend, Emmett Reed, CEO and President of the Florida Healthcare Association. Emmett, thanks for coming on.
It's my pleasure, Brad. Great to be here.
All right, so we're kind of in it right now, but before we really get into the policy, give us a little bit of background. How did you get involved with FHCA?
Oh gosh, well, believe it or not, February 9th, which is coming up next week.
1975, right?
No. Well, whatever 13 years ago was.
Okay.
13 years ago, I think it was 2009, does that sound right?
Sure.
Interviewed for the job, got it, was very interested in healthcare, and wanted to make a difference in long-term care especially, and really found a home there the last 13 years and love what I do.
Well, it's really clear, and as a colleague and as somebody that we've known each other for a long time, you are both interested and fascinated by the healthcare aspect and the great work that you guys do, but you're also fascinated with running best practice associations. It's really, it's a pleasure to watch how you do what you do. All right. So, in your time at FHCA, what are you most proud of that either day to day, year to year, or since you started?
Well, I would say two things. Number one is, since I started, the quality in Florida's nursing homes has increased dramatically. And so that was one of my goals. Whenever I started, I talked with my wife about, hey, should I take this job at the nursing homes? And we agreed, if you do, let's make sure that we focus on quality. So that's number one. And number two, internally, building an incredible team to serve our members. Because if you had a great team, they make everybody look good, even me. So I think those are the two things I'm most proud of.
Yeah, you've built a great team over there. When we think of the work that you do on behalf of your members, I guess what's the biggest challenge that nursing homes face every year? Like what? I mean, if you had to rank them, one or two.
So there's two. I mean, I can give you two. There's plenty others, but the top two are always perennially funding and staffing. The staffing was not as bad of a challenge before COVID. It was still a tough challenge, but COVID just exacerbated it, and it is really a major challenge in nursing homes to the point that it's creating an access issue for Floridians to actually be able to access care in their local nursing home. And then funding it's a very complex funding system. In 2017, we actually proposed and advocated for, and the legislature agreed and passed a prospective payment system. I won't get in the weeds, but it is yet to be fully funded. So if we can get that thing fully funded, I think the funding matter may take care of itself. We still got a major staffing issue.
When we think of funding, I mean, is this predominantly federal funds that are coming down and moving through a state mechanism to go to these facilities, or is it private pay? I mean, that seems like it would be such a rare scenario.
It's both. I mean, when I say it's both state and federal funding. That's primarily how we are funded.
Right.
And the state is our biggest partner.
Right.
Make no mistake about it. Private pay, as you say, is very rare. Insurance, very rare. Right. It's mostly Medicare and Medicaid.
Yeah, it's not lost on the news cycle that Governor DeSantis took a very different tact and turn during the COVID crisis, and tell us a little bit about that. I think no one tells that story better, but I think it's worth reminding folks just what happened in Florida's system versus other states.
Yes, well, I tell you, it was such a stressful time for everybody, but especially folks in healthcare. Nursing homes were no exception, and the governor made it a point and met with us early and often, and using science, made sure that nursing homes were protected. And the first step he made was, he said, if you are in the hospital and you have COVID and you need long-term care, we're not putting you in a nursing home until you're clear of COVID. We saw what happened in New York. It was tragedy. The governor was not going to let that happen in Florida, and he has since, every step of the way, protected Floridians in nursing homes. Done a great job.
I mean, it's an amazing testament to how our seniors survived. And you think about the breadth of seniors that we have in Florida versus other states. It's obviously, it's the world's retirement.
20% of Floridians are 65 and older.
Right, and there's hardly any other states have that kind of number in healthcare system. Okay, let's get into the legislative session. You've got a great team on the ground. We know them all. We see them running around. What are you working on this year? It's got to be funding, right?
Right. Well, yeah, right. I kind of outlined it earlier on. The funding is a huge issue for us. So we have two, I would say, issues that are equally important, the funding and the staffing. First is the funding, and really, I think that the legislature is hearing us, and I want to commend the legislature as well, by the way. The governor did a great job, and then last year, the legislature actually came through with some funding to help nursing homes survive through the last quarter of last year, and we're very grateful for that. Now what we're looking for is an increase with an inflationary aspect to it, so that we don't have to come back every year and beg for money and ask for money. We can just say, look, we've got a system in place, the system is good, we're fully funded, and the inflation is taken care of annually. So that's a huge issue. And then, do you want to talk about staffing?
Yeah, let's talk about staffing, because I know one of the big things is as people leave the northern cold states, to come to Florida, reciprocity, and there's a million little nuances of how you qualify. But where are you guys starting out in advocacy on staffing issues?
Well, staffing issues, obviously, we are in favor of any type of reciprocity that we can safely give to those folks. But really, what's happening, it's a bigger issue, is with the COVID stress and the lack of ability to increase pay to our CNAs, especially, and our nurses. They're leaving the profession. They're either going to a hospital and getting paid more money, or a CNA might just go down to the Chick-fil-A down the street. The difference between a Chick-fil-A and a nursing home, Chick-fil-A can increase the cost of their chicken sandwich, and I love Chick-fil-A, by the way. They can modify their hours if they need to, a restaurant can. Whereas a nursing home, it's 24/7, 7 days a week, it never changes, and the payment is set. So we have limited resources right now to be able to keep the staffing. And then there's a major issue with some staffing agencies that are, we think they're predators. They're coming in and they're basically taking our nurses from us and then selling that nurse back at double and triple their pay. It's really a bad situation right now.
So what's the answer, or what's a remedy, or what's a middle step to either stem the bleeding, if you will, not to use a medical term, but what are you guys doing to mitigate these challenges?
Yeah, well, there's several things. Obviously, the funding will help. However, we also are looking for some relief on the staffing requirements, that nursing homes are required by law to have a certain number of staffing hours, nursing hours, and we don't want that to diminish. What we want to do is a nursing home has changed. Nursing home has changed in the last 20 years. We've got respiratory therapists now. We've got mental health. The opioid crisis has pushed us to the limits on the mental health care that we're giving. We want to be able to count those folks that are giving that care toward the total hours of care. That will give us some significant relief. So it's something that we're talking with the legislature
about. It's a change in the
about.
structural funding model, essentially, because of that.
Correct.
All right. Well, so we've talked about the challenges, which is always kind of takes the wind away from you when you hear it, because it's such an important group of our population and group of providers, frankly. To what's next in the industry. We in our business, we're providing connectivity, and there's a new widget that comes out every day that can hopefully address some challenges or problems, or just even make it better. What are you guys doing in the healthcare industry as far as innovations?
Well, you're going to love this, but telemedicine is finally catching on in long-term care. There was a big federal tranche that came down years ago, didn't include long-term care. So again, with the funding stresses, nursing homes were slower to adapt it. Now, especially the larger nursing home companies are seeing the huge benefit. COVID almost forced it on many of them, and they've embraced telemedicine. Really, it's limiting or lessening hospitalizations, which is good for everybody, and keeping the resident at their nursing home, their home away from home, longer, and keeping them safer. So they've embraced it completely. On the larger groups, we're trying now to work with some of the smaller nursing home groups and showing them how, because it's complex, right? There's billing issues and things of that nature, technology technological issues that you've got to help them with. But that's what we're doing as an association, help bring them forward.
Yeah, I mean, I think, we think about, the childhood, or at least what we saw of the town doctor that would travel around, and really, in telemedicine, it's kind of it's a modern Mayberry, right?
Yeah.
This is the ability of your town doctor to do an in-home visit, essentially, and and let's face it, when elderly have to chase appointments and be out of the home or be transported,
Right.
in many cases or a lot of cases, that's
and that costs money.
It's expensive, right?
Yeah,
right.
yeah.
And
Have you used telemedicine?
I have, actually.
Isn't it cool?
Yeah,
It's amazing.
Yeah. I got prescriptions, and I was like, "Is that it?" That was really
it's
easy.
It's really incredible.
We know that as our members invest in broadband capacity, so much of it of medicine is still observational, and so seeing someone's skin tone and color and things like that. But when we talk to our telemedicine people, it's the broadband capacity that's really makes a difference in that world. And I think, with the federal money coming down for you guys, and obviously for cities and counties and governments and our members to speed that up, I think we're all collectively working on a better telemedicine platform. But that's exciting. That's exciting. All right. So in our last minute here. Talk about what you want Floridians, the legislature, to take away from where the state of providing these services are, and what do you need most?
We're in a crisis. Mm-hmm. And again, not to sound like a Debbie Downer, we're just in a crisis. It's a fact. We're in a staffing crisis and a funding crisis, and we need help. The folks that are working in nursing homes right now are truly the healthcare heroes, the ones that want to be there, the ones that want to care for our grandmas, grandpas, aunts, uncles, mothers, fathers, brothers, sisters. And so we need to make sure that we don't forget what they've been through. This is very important because I'm seeing that start to happen. They're starting that mission creep of what have you done for me lately?
Right.
Don't forget these people. Right. Don't forget these heroes. They have done unbelievable work.
Yeah, well, Emmett, we know no one's doing more to advocate for that group than you and your team, and we'll look forward to having you on again soon to hear where you stand in the legislative process.
Thanks, Brad. Appreciate it.
Thanks, Emmett. That's all the time we have for this episode of FHCA TV. Make sure you hit us up on our social media feeds for more great interviews like this one. And for now, thanks for tuning in.